I really feel strongly that access to clinical trials is a right. And through the NCORP, we can provide that.
NCORP, the NCI Community Oncology Research Program. Prevention, treatment, supportive care, and cancer care delivery research.
Community cancer research is the future because we can't have them all go to large cities to go to comprehensive cancer centers. We have to reach out to them where they exist.
Doesn't matter what color you are, what language you speak, we want you to have access to the very best that we can offer you.
We realized that, well, if we had the opportunity to bring the clinical trials right to our patients and right in our own community, then that would make more sense to keep them there with their family, their friends, their own environment. That would be much better, much more comfortable for the patients.
NCORP is a network that conducts clinical trials in the communities where most patients live and receive their care, with over 9,000 doctors, nurses, and research staff. From 2014 to 2018, around 27,000 patients have been enrolled in NCI clinical trials through the NCORP sites, contributing 1/3 of the total accrual for NCI cancer treatment trials. That means 1 out of 3 NCI cancer treatment trial patients come from NCORP sites.
The vast majority of consumers of cancer care are not in academic healthcare systems. Where cancer occurs, it's actually on the street, in the rural regions of the United States, in the poor communities of the United States. So if we are interested in making a difference, what we really need to do is understand how the various ideas, the drugs, the treatments, how they truly work for the person living with the burden of cancer.
In our communities, especially in many of our minority communities, the access to cutting-edge clinical research, whether it's treatment, whether it's symptom management, whether it's survivorship, is not available other than through participation in studies.
One of the things that you always worry about with clinical trials is whether or not you're getting a good sample representation of the entire population and whether or not those results really apply when you go see the next patient.
About 25% of cancer clinical trial participants from all NCORP sites are minorities. The NCORP encompasses nearly 1,000 sites across the United States, including physician practices, public hospitals, academic medical centers, and local organizations. NCORP brings cancer research across the country.
I'm the principal investigator of the Puerto Rico NCORP.
The entire South Texas area and Central Texas.
In Louisiana.
Mid-South, minority underserved, NCORP.
It's at the foothills of the Blue Ridge.
Into New York City, New Jersey, Connecticut.
Northern Wisconsin down to northern Illinois.
St. Paul, Minnesota. We're a multi-state NCORP, Michigan, Pennsylvania, and Massachusetts.
Hawaii, most of the West Coast, Colorado.
NCORP serves people from diverse settings across the nation, giving hometown access to the latest cancer research, and not just in the area of cancer treatment.
NCORP from diagnosis to treatment down to survivorship care.
It can also include cancer control, cancer prevention, and something called a cancer care delivery research.
We are in a rapid age of discovery, especially in cancer care delivery.
From 2014 to 2018, over 40 clinicians and 6,000 patients have been enrolled by NCORP sites to cancer care delivery research studies.
The reason we do clinical trials is because the research of today are the standards of tomorrow.
Because of the advances that have occurred through the National Cancer Institute and through the NCORP consortium, these patients are living longer. They feel safe. They feel comfortable, and they have hope. And that is an extraordinary thing that the NCORP gives our patients.
Making it easier for people to enroll in clinical trials, no matter who they are or where they live, helps improve cancer care for everyone. For more information about the NCI Community Oncology Research Program, or to look for an NCORP site near you, go to ncorp.cancer.gov.